Here's what you don't want to hear in a press release issued by local public health. Transmission is occurring throughout the community in workplaces, schools, sport and recreational settings, healthcare settings, and within vulnerable populations. But that is pulled directly from communications from Algoma Public Health this week, as cases there are surging. With us for more from Sault Ste. Marie, Dr. Jennifer Liu, Medical Officer of Health for Algoma Public Health. Welcome.
Thank you for having me.
Dr. Liu, thank you so much for being on the show. I know you're pretty busy. Just before we start our conversation, when we talk about Algoma Public Health, what are some of the main population areas aside from Sault Ste. Marie?
For sure. So, Algoma Public Health covers a large area in the northeast of Ontario. Our service area is essentially between Thunder Bay and Sudbury. So, we work with 21 municipalities, as well as 8 First Nation communities whose territories are the land of the municipalities that we serve. And some of our communities are a few thousand people, like Elliott Lake, 10,000, Blind River, Wawa. Some of our communities are much smaller. They have a few hundred people. And for those of you not very familiar with Northern Ontario, so if you were in Toronto and wanted to fly to the Soo, it's a very quick, about 1 hour flight, because you just cut right across and fly diagonally northwest across the lake. If you're driving up, don't know how far you've
It's
ever gone
longer.
up. It's a bit longer. Yeah, it's about a 7-hour drive to get to the Soo. If you're driving from Toronto, go north, head up the 400 until that stops, and keep going past Barrie. Once you hit Sudbury, you head west, and then that's when you eventually get to Algoma and you hit some of our municipalities, just skimming along the north shore or the north channel of Lake Huron. And Sault Ste. Marie, our biggest municipality with about 74,000 people, that is nestled just where some of the Great Lakes meet, Lake Superior, Lake Huron, and Lake Michigan.
So a very beautiful area, a very diverse area, but your public health region is currently grappling with one of the highest rates of transmission within this province. Can you give us a snapshot of what's happening there?
For sure. So right now we have just over 230 active cases with about 15 people who are hospitalized. The vast majority of our cases and transmission has been happening in Sault Ste. Marie. And to give you some sense and context of those numbers, throughout the pandemic, a total number of cases that we've had is around 800. So what we're really seeing is that about a quarter of our total cases have been happening within the past couple of weeks, and that has been a huge surge. If you remember that color-coded framework from last year, a 7-day incidence in the 50s would put you in the red zone. Our 7-day incidence most recently has been 130. So we're way above that. And that has been a tremendous impact on our local ability to keep up and manage these cases and do contact tracing.
I read part of that press release, and it's very shocking. Are you alarmed with what's happening right now?
I think all of us, as we headed into the fall, were gearing up for a potential resurgence of the virus. And, obviously, you prepare for the worst. You hope it doesn't happen. But what we're seeing right now is not particularly surprising. We know that as restrictions ease, people want to go back to normal. It has been a very, very long pandemic for all of us. And as soon as people get a signal that things are improving, we want to go back to all those activities that we used to enjoy and have lots of visits with one another and friends and family. Unfortunately, the virus is still circulating. It is the Delta variant, which is very transmissible. And when we have people becoming a bit more complacent with things like masking and distancing and having more social contacts, put that together with colder temperatures and people moving indoors, that's when we have a bit of a perfect storm of transmission. And that's what we're seeing as well. Here in the north, obviously temperatures drop a little bit sooner than in southern Ontario. We have snow on the ground right now at this moment in the Soo. So all of those factors combined together have been driving this current surge.
What is the vaccination rate in your region?
Happy to say that immunization has been really successful here in Algoma. Just last week, we reached the milestone of over 90% of eligible people having gotten at least their first dose, and over 86% of people eligible are fully immunized here. Over the past weeks, we've continued to provide third dose boosters as well as first and second doses to people. And we're reminding folks that, now is the time to get immunized if you want to be fully protected in time for the holidays. It's just 5 weeks out now.
Are the majority of the people who are getting COVID now are the cases amongst the people who are unvaccinated?
Yeah, so what we're seeing is that the majority of cases at this time are people who are not yet fully immunized. About 65% of our current cases in this fourth wave have been people who are not yet fully immunized, and about 35 percent of our cases are amongst people who are fully immunized. We know that the vaccines provide really good protection against severe disease. And again, of the people in hospital, based on what we're seeing with our hospital partners, about 75% of people hospitalized with COVID right now are those who are not fully immunized.
I read too somewhere that people are being told not to visit people at hospitals. Um, is that happening right now?
So at this point in time, Sault Area Hospital, which is our major tertiary care center, has put some visitor limitations in effect. Again, this is to protect patients and to protect staff as well. We are in a situation where there's more community transmission. So there's certainly small exceptions where visitors are possible for compassionate reasons or for certain health situations. But for the most part, visitors have been restricted in the hospital setting.
What is your capacity in terms of hospital beds?
So I don't have that number offhand. Happy to get it for you with our hospital partners. But again, in close conversation with them, staffing capacity and beds are stable right now. However, some elective procedures
Mm.
at the local hospital have been rescheduled. We haven't reached the point yet where we are, canceling surgeries, but certainly that's what we want to prevent. We don't want to disrupt healthcare services to our community. We want to protect them and preserve them, and the best way to do that is to make sure that we curb the current transmission.
We talked a little bit about why cases might be going up because it is getting colder. You already have snow on the ground, but your region was relatively unscathed by COVID last year. So, what would you say are the key factors behind this outbreak?
Absolutely. So I think that right now we are in a situation where people have enjoyed a wonderful late summer and early fall. They've been able to do some traveling, visiting, doing all the activities that used to be normal before the pandemic. And the more we do them, the more we see one another. The more complacent we can get. We tend not to distance or mask anymore. And even in the workplace, restrictions have been gradually being lifted throughout the fall. And again, this is what we wanted to do, but obviously things change when the temperatures drop. And once we have people doing a lot of socializing and having unmasked close contact indoors, this is when the virus starts to spread. And I think the other piece is some misperceptions around the protection of vaccines. Vaccines provide great protection. If a person gets infected and they're fully immunized, chances are they're not going to have severe disease. And if they're otherwise healthy, they're not going to end up in the hospital. But the vaccines don't make us invincible, right? And so, what we're really trying to tell people is that if you've been fully immunized, fantastic, and thank you. And you can still have a mild infection and spread that infection to others. So we're really urging people at this point in time to take note of those mild symptoms. Don't brush them off and then take yourself to work or school. Get tested and stay home if you're sick.
As you've mentioned, it's been this pandemic has been very long, and vaccines are not just the one tool that we have in our toolkit. From your vantage point, were businesses following health and safety protocols by enforcing masking, social distancing, and so forth?
Absolutely. I think vast majority of businesses have had their safety plans in place and good solid policies and procedures, including vaccination policies. Lots of our local businesses have been implementing those with great effect. Again, at the end of the day, though, even if you have a fantastic policy and solid procedures on paper, it comes down to what's happening in reality with human behavior. And as we know, in public health, human behavior can be really challenging to change, and sometimes it takes time, it takes repeated efforts. But this is bread and butter public health, right? Whether it's smoking or eating healthy or exercising or drinking habits. These are the kinds of human behaviors and health behaviors that we're always working with our local partners to try and manage.
Mhm.
And sometimes it's a combination of education and training, posters, setting up the physical environment so that you're by default distancing. And sometimes it's a matter of enforcement as well. So we use all these tools in public health and work directly with a lot of our local businesses to make sure that as much as possible they stay open and stay safe.
Because some businesses, if you're especially in the public sector, have required people to get vaccinated, but some private businesses haven't. Algoma Steel Mill in Sault Ste. Marie doesn't require workers to get vaccinated. Do you think that that played a role in this surge?
Sure. So I think that absolutely, when you have a strong vaccination policy in place at the workplace, it can encourage people to get immunized. And we continue to work with a lot of our trades and similar workplaces to see if they're able to put policies in place to encourage immunization. But sometimes that's challenging as well. And there are other ways too that we need to look at assisting people to be able to wear proper PPE, follow protective measures when they're in the workplace, not gather so much, and again it comes down to, yes, immunization and all these other protective behaviors.
Um, Given your proximity to the US-Canada border, do you feel that the border reopening might have played a role in this?
Yeah, so as a border community, we've always been acutely aware of what's going on just across the river in Sault Ste. Marie, Michigan. We know that a lot of essential workers have continued to go back and forth and have been able to do that throughout the pandemic. Some local healthcare workers commute to work at the hospital across the river in Michigan. We have students who live in Sault Ste. Marie, Ontario, attending Lake Superior State University. And, as the border has reopened, this back and forth certainly has gone up. And as part of our overall messaging to the community, we're always making people aware of what the COVID situation is like just across the border. In the past weeks, the Upper Peninsula of Michigan certainly has seen high rates of COVID as well. And we're making sure that people know that and know their risk before traveling to make sure that they keep their masks on and they keep their distance in these communities, even if there's not a lot of rules there, as there are still here.
I know you've been working hard throughout this pandemic, and I think a lot of people have been looking forward to the holiday season, and now with numbers going up, what is the mood in your region? Is there a sense of frustration that this is where you are now?
I think obviously there's a huge amount of fatigue with this pandemic. People really crave that normalcy, and we remember the challenging times of last year during the holiday season when there were very restrictive lockdowns in place and you could not really gather with friends and family. The purpose of the entire pandemic response has always been not just to limit severe disease and death, but also to limit societal disruption. So the actions that we're urging people to take now are really so that we don't have to take even more restrictive actions down the road, and especially, during the holiday season.
What are those
We
actions that you're taking now to curb the spread?
For sure. So last Friday, we issued a very strong, clear message to our local communities, asking everyone to take three key actions. Number one, get vaccinated. Number two, stay home if you're sick, even if it's mild symptoms. even if you've been fully vaccinated. And number three, cut down on those unmasked, unprotected, close contact interactions with one another. Um, we have, in the North, a very good culture of dealing with winter. Winter comes every year. It's never fair, but it does. And, every time there's a huge, giant snowstorm with 6 feet of snow, we don't see speed limits go down. What we see are people driving according to conditions. And this is exactly what we need everyone to do right now. Surges of activity can hit communities at any point in time, and people need to be aware and adjust our behaviors accordingly. So now with this giant surge, now is not the time, to have a packed social schedule, full extracurriculars every day of the week, plus evenings and weekends. Now is the time to cut back, pause, and postpone those non-essential gatherings until transmission is lower. So those three things were the main key actions that we're asking everyone to do right now. And as you'll noted in this Monday, the health unit also took some action. We issued a class order section 22 requiring isolation on a legal order. We encouraged Sault Ste. Marie businesses through a letter of instructions to essentially instruct them to reinstate capacity limits that were recently lifted and put back physical distancing on their premises. And we also now require anyone 12 plus participating in indoors organized sport to demonstrate proof of vaccine. So the health unit did a number of mandatory measures in our region, and at the same time, we're asking every resident and community member to do their part and slow down, cut back on close contacts.
One of those action items that you mentioned is for as many people to get immunized as possible. And this Friday, Health Canada authorized the Pfizer vaccine for kids aged 5 to 11. Is your region prepared to roll out the vaccines for that age group?
Absolutely. We have been waiting and very excited to hear that the approval of the Pfizer vaccine is now here for 5 to 11-year-olds. And our clinics across our district, across our 21 municipalities and that 7-hour drive, we have been working really hard with partners over the past few weeks to prepare for this moment so that as soon as we receive that vaccine product, those pediatric formulations, we will be able to start rolling them out and administering them to our kids. We did a survey actually a few weeks ago just to see what the preferences are of our parents. And it looks like, people prefer a variety of options. There are some who really want to get it done in their doctor's office, some who like the community clinics, and we're making those kid friendly for the next few weeks, and some who like the convenience of pop-ups and drop-ins. So we'll have some school-based clinics after hours. We'll certainly have community clinics, and we have many pharmacy partners and primary care partners as well who are offering in their clinics and offices.
In our last 20 seconds, I know you're from southwestern Ontario. A lot of people from here will probably be coming up there for Christmas. What do you say? Or are you even concerned about, maybe that will make the situation worse?
So again, I would say that now is the time to drive according to conditions. Keep an eye on what COVID activity is like locally where you are right now and at your destination. We want to make sure that people remain safe over the holidays while they're gathering with loved ones. And now is the time, 5 weeks out, to take additional precautions so that we avoid a worsening surge and we have the ability to gather.
Dr. Liu, thank you so much for taking time to speak with us. We know you're very, very busy, and we wish you all the best during this challenging time. Thank you so much.
Thank you, Nam.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.